Welcome from New Orleans. My name is Michael Feldman, one of the associate editors of Arthroscopy, and it is my pleasure to introduce the June issue. The knee is front and center in this issue, with 8 out of 17 original articles and 3 of 5 systematic reviews dedicated to further understanding of knee problems, and more specifically, the treatment of knee ligament injuries. Schmoller et al. And Boniello et al. Both address the question of hamstring graft strength versus graft diameter for knee ligament reconstruction. Surprisingly, they both come to different conclusions regarding the minimum graft diameter for reconstruction. Please read to see what you think. Papaglia et al. Perform a systematic review to evaluate hamstring tendon regeneration following harvest. The overall rate of tendon regeneration was 86% in their study. However, the question of graft reharvest was not addressed. Now that you've determined whether or not to use hamstring grafts, can we predict who is at increased risk to develop an ACL tear? Holman et al. Compared three-dimensional femoral notch volume in ACL deficient versus ACL intact patients. As predicted, women in ACL deficient knees both had significantly smaller notch volumes. Single bundle versus double bundle ACL reconstruction remains a hot topic, and this issue furthers the debate as Mascarenhas et al. Performed a systematic review with overlapping meta-analysis to determine if double bundle ACL reconstruction improves postoperative knee stability compared to single bundle techniques. You may find their conclusions interesting. Is there a difference in quadriceps strength and endurance between PCL tears and a matched group of ACL tears? Read the article by Lee et al. To see if there is a difference. For those interested in shoulder injuries, Zhang et al. Report on the outcome following arthroscopic decompression of inferior labral cysts combined with labral repair. The incidence of inferior cysts in their study was 0.6%. Satisfactory results without recurrence were noted, and surprisingly, these cysts were seen only in male patients. McClincy et al. Evaluated posterior shoulder instability in throwing versus non-throwing athletes. They concluded that arthroscopic capsular plication is effective. Capsular plication with suture anchors provides the best odds for athletes to return to competition. Athletes with a discrete labral tear had a tenfold likelihood of return to play, and 60% of throwers returned to play, but only 50% of pitchers returned to sport. Sayegh et al. Performed a systematic review and meta-analysis evaluating the surgical treatment options for glenohumeral arthritis in young patients. Read the article to determine which option is best for your patients. For those who perform hip arthroscopy, the June issue has articles regarding treatment of the young and the old. Eberhard et al. Report on the arthroscopic anatomy of the dislocated hip in infants and obstacles preventing reduction. They determined that the procedure can be safely and successfully performed. They also found that the number one block to reduction was the capsule, with the ligamentum teres number 2. On the other end of the spectrum, Hariri et al. Evaluated the biomechanical and cellular assessment of acetabular chondral flaps identified during hip arthroscopy. After reading this article, you may rethink your decision whether to repair or resect these chondral flaps. Frank et al. Performed a systematic review to evaluate the prevalence of femoral acetabular imaging findings in asymptomatic volunteers. Findings revealed a mean alpha angle of 54 degrees, cam lesions noted in 37%, but increased to 55% in athletes, pincer lesions in 67%, and labral injuries in 68%, thus confirming previous studies that labral injuries and FAI morphology are common radiographic findings that underscore the importance of clinical correlation. And for those interested in the science behind the science, Xi et al. Studied whether PRP inhibits mechanically induced injury in chondrocytes. Gulyasuz et al. Evaluated the influence of temperature on the biomechanical stability of various suture anchors on human humeri in a wet environment, and Hung et al. Tested the elongation properties of 3 needleless grasping suture techniques for soft tissue graft fixation. Suture configurations tested in their study included the modified Prusik knot, the Wittstein suture loop, and the modified rolling hitch technique. The favorable results make these techniques an alternative to commonly used whip stitch technique. Please watch the video of this study on the Arthroscopy Journal website at www.arthroscopyjournal.org for more details. Finally, please don't forget to read the editor-in-chief's editorial entitled "Change is a Constant," as Dr. Lubowitz gives thanks to 2 important and valued behind-the-scenes contributors to the success of the journal as they embark on their retirements: Managing Editor Hank Hackett and ANNA Executive Director Ed Goss. Happy reading and enjoy the June issue.